Okay, so today we're tackling a big one, the US healthcare system. It feels like it's under some serious pressure, right? We're going to dig into why your costs just seem to be always going up and what the future could and maybe should look like. Let's dive in.
I mean, does this feel familiar? That feeling when you look at your healthcare bill and just wince? It's that pinch, Whether it's the premium coming out of your paycheck, a bill you weren't expecting, or just the price of a prescription, that squeeze is real. And honestly, it feels like it's only getting tighter.
And look, it is not just in your head. The numbers back it up. A new KFF survey found that the average premium for family coverage, through your job, shot up 6% this year. Just this year. That's a serious jump. It's outpacing inflation, and it's money that's coming right out of your pocket.
But as bad as that sounds, hold on, there's a huge policy change coming down the pike. And for almost 5 million people, this whole situation is about to go from a tight squeeze to, well, a full-blown crisis.
All right, so first up, let's talk about the most immediate threat to your wallet. This is for all the folks who buy their own insurance on the Affordable Care Act marketplaces.
Okay, here is the absolute key. You know that extra financial help, the enhanced subsidies or premium tax credits that have made insurance more affordable for millions? Well, they're set to just end at the end of 2025. And if Congress doesn't do something, the average person's premium is going to more than double. That's a 114% increase. I mean, that is just a staggering number.
And this isn't some far-off possibility. Insurers are already planning for this. They're already putting in for huge rate hikes for 2026. Why? Because they're betting that without that financial help, a lot of the healthier people will just drop their coverage. And that leaves them with a smaller group of people to insure who are, on average, sicker and, you guessed it, way more expensive. Okay, so that's the individual market. But what about the rest of us, the majority of Americans who get health insurance through their job? Well, the pressure is just as real, but companies are trying to handle it in some interesting ways.
Remember that 6% jump we talked about? Yeah, that wasn't a fluke. It's part of a trend that just doesn't seem to stop. Over the last 5 years alone, family premiums have shot up 26%. That is a massive cost for businesses to absorb. And you know what happens next, right? They pass it along to us, the employees, through higher premiums or messing with the plan design.
And one of the biggest tools they're using is something you might have run into, a narrow network. Basically, to save money, they restrict the number of doctors and hospitals you can go to. By doing that, they can negotiate better deals. The catch for you, of course, is that you have way less choice about who you can see for your care.
For a lot of small businesses, though, even tricks like narrow networks don't cut it. The cost pressure just gets to be too much, and they reach a breaking point where they can't offer insurance at all. And when you ask them why, the answer couldn't be simpler. It's just too darn expensive.
So we've got these intense financial pressures on people and on companies. But there's something else going on, a much deeper, system-wide problem that's making everything worse. It's actually a huge reason why costs are so high. We just don't have enough doctors and nurses.
Get a load of this number. By 2037, which is not that far away, projections show that 47 states, almost every single state, will have a shortage of primary care doctors. This is not some small regional problem. This is a full-blown nationwide crisis that impacts every single one of us and our ability to get even the most basic care.
And if you look at this chart, you can see the problem isn't spread evenly. It's hitting rural, non-metro areas way harder than the cities. This just makes existing inequalities even worse. It means people are waiting longer for appointments, driving further for care. It's a huge problem.
So what's going on here? Why is this happening? Well, it's kind of a perfect storm. On one hand, you've got an aging population that just needs more and more complex care. That's the demand side. But on the supply side, we're losing doctors and nurses to burnout. We can't keep them in the profession, and the ones we do have aren't spread out evenly across the country.
Okay, so costs are up, the number of doctors is down, the pressure is on. So what are policymakers actually trying to do about it? Let's look at two of the biggest moves being made, one at the state level and one at the federal level.
So you've got two main fronts in this fight. At the state level, places like Massachusetts and Oregon are putting in what are called cost growth targets. It's pretty much what it sounds like, a speed limit for how fast healthcare spending is allowed to grow. Then, at the federal level, you've got a huge one. For the very first time, the government can directly negotiate drug prices for Medicare. They're going right after one of the biggest reasons for high costs. But do these state targets actually have any teeth? Well, yeah. Here's how it works. They find the hospitals or insurers who are spending too much. They ask, is there a good reason for this? And if the answer is no, they force them to create a public plan to fix it. And if they still don't get their costs in line, they start handing out some pretty hefty fines.
And that federal program, it is a huge deal. I mean, for decades, it was literally illegal for Medicare to negotiate drug prices. The Inflation Reduction Act completely flipped the script. Now, the government can go after the most expensive drugs, the ones with no generic competition, and basically say, we're not paying that. The goal is to save billions, both for the government and for seniors. So these are big changes, for sure. But some experts are looking at all this and saying, you're just patching holes in a sinking ship. So what if the answer isn't about fixing the system we have? What if we need to build something totally different?
This quote from the Rand Corporation, it really hits home. They're basically saying we can't just create more doctors and nurses fast enough. The demand for care is growing so fast that our ability to train new people just can't keep up. So if we can't make more people, we have to completely rethink how we deliver care in the first place.
So what does that rethinking actually look like? Well, idea number one is to basically blow up the idea of a hospital. Instead of forcing everyone to go to one giant expensive building, you bring the hospital to them. We're talking telehealth, remote monitoring, full-on hospital-at-home programs. This could be a game changer for both cost and especially for people in rural areas who can't easily get to a hospital.
Okay, idea number 2. Give our existing healthcare workers superpowers. Seriously, use AI to take care of all the soul-crushing paperwork that leads to burnout. Use robots to help with simple, repetitive tasks. The whole point is to free up the actual humans to do the complex, critical thinking stuff that only they can do. It's about letting them do more with less. And the third idea, this might be the biggest one of all. What if we shifted the entire focus of the system? I mean, right now we basically wait for people to get sick, and then we spend a ton of money to treat them. What if we built a system that was all about keeping people healthy in the first place, focusing on prevention, education, and catching problems early? That would change everything. Look, we're really at a breaking point here. You've got cost, access, and a workforce shortage all colliding at once, and it's pushing the system we have to its absolute limit. So the real question for all of us isn't if we need to change anymore. It's what kind of future are we actually willing to build?